relating to SHA. I know there are other questions. If we reach them, well and good, but I want us to focus on the SHA issue because of the public interest around it. Honorable Duale, you're welcome to the House. And I'll invite the first questioner, question 002 of 2025, Honorable John Kawanjiku. Are you Kawanjiku or Wanjiku?
Yes, Kawanjiku is my name.
Yes. I've misspelled your name.
Thank you, Honorable Speaker. Thank you, Honorable Speaker. I rise to ask these questions to the Cabinet Secretary. Could the Cabinet Secretary provide an update on the operation of the Social Health Authority, including key milestones achieved and challenges since inception, and what legal reforms could be proposed to address the challenges that SHA has faced so far, if any? Question 2, explain how teenage mothers without national identity cards and indigents will be identified by the system deployed by the authority and state measures the ministry has put in place to ensure immediate access to services upon payment of contribution without being subjected to adverse selection process, such as awaiting periods. Question 3, state the nature of covers offered by the authority at all levels of public health.
Hold, clerk or sergeant, can you check why we have an echo on the sound system? Use the next mic. Go on.
Okay. Thank you, Speaker. Question 3, state the nature of covers offered by the authority at all levels of public health facilities, the contribution payable and benefits accruing to individuals and households, and the extent to which the covers offered under SHA are sufficient to ensure access to quality health services by all Kenyans. 4, explain how the referral system under SHA works and how effective is the system towards guaranteeing access to referral health services by all Kenyans. Number 5, enumerate the process of employment of health facilities to the SHA system and clarify the status of former employees of NHIF and indicate the current staff establishment of SHA. Thank you, Speaker.
Yes, Minister. Wanjiku, you have 2 questions? Okay, let's deal with that. Minister.
Thank you, Mr. Speaker, and thank you for giving me an opportunity to come and address the August House. So question 1, what are the key milestones achieved? I want to confirm to the House that free primary health care service for 21,390,659 people or citizens in all our public health facilities, level 2 to level 4, and this is the dispensary, the health center, and the sub-county hospitals, and those contracted both private and faith-based level 2 to level 4 facilities are open to our citizens 24/7, and they are free. And these facilities, Mr. Speaker, which have been accredited both for the public, the private, and the faith-based, are available. It's public knowledge at the SHA website, www.sha.go.ke. 2, the other milestone is universal health coverage for primary health care in 6 months since SHA started in October, is at 40% within the last 6 months. So 40% of our citizens have accessed the universal health coverage. The actual numbers I have said is this 21,390,659, they're part of it. And Mr. Speaker, every day, and this is the good news, every day, including today, every day between 40 to 50,000 Kenyans register for SHA. As I was waiting for my colleague to finish, 38,000 have registered for SHA. 18,000 have gone through the mean testing, and it tells you the kind of reception and publicity and the eager Kenyans wants to access this facility. The third very important milestone is that improved health benefit packages are offered by SHA as compared to the defunct NHIF. Which are these services? ICU, today 28,000. If you are a member of SHA and you go to an ICU, 28,000 will be paid by SHA. Under the defined NHIF, it was zero. Today, you can use SHA for cancer treatment. Today, all surgeries are partly paid by SHA. Today, maternity is paid by SHA at a very good figure of 30,000. All these benefits were not available under the defunct NHIF. And we will keep improving the benefits package until we weed out all medical Harambe WhatsApp groups in our country. And as a former member of parliament, Mr. Speaker, this is one of the biggest challenges leaders and members of parliament of this house go through every weekend and every day in various WhatsApp groups raising funds for the sick from their constituencies. 4, the operationalization of free emergency services in any health facility as envisaged under Article 43, sub-Article 2 of the Constitution. In that Bill of Rights, Article 42 says, no Kenyan can be denied an emergency. For example, you get a cardiac arrest, you get a stroke, you get an accident. Before, when you go to a hospital, the first thing they used to ask you was the deposit. Under this SHA, this is the first administration that has operationalized, actualized Article 43(2) of the Constitution. No hospital, Mr. Speaker, let me say it unanswered, can deny a Kenyan admission. The government is going to pay for you. And if a facility denies a Kenyan who has an emergency, I want to assure this house that facility we will be registered. For the first time, I am proud to say that a provision in the Bill of Rights has been achieved. Secondly, the fifth, timely payment of claims. All claims are paid on the 14th day of every month. Mr. Speaker, 14th of this month, which was 2 days ago, I want to assure all facilities that both public, private, and faith-based were paid. I stand and I want this house to hold me to account. If facilities are not paid, their claims by the 14th of every month. We have done that. NHIF, the former NHIF, had no payment timelines. And that's why they left us with a bill of close to 24 billion. What are the challenges that the member have asked? We face challenges. The system is a super technology highway. Some employees are not remitting statutory contribution to SHA, denying service to their employers. Speaker, you are the chairman of the Parliamentary Service Commission. The clerk to the National Assembly is accounting officer. You remit statutory deductions, whether it is payee or NSSF or SHA, to us. We wonder why other arms of government and other levels of government should not do the same. But I want to confirm to the House that under my leadership, at least for SHA contribution, whether you are in private, in public, in the county governments, and I had a discussion with the Minister for Finance, it should be a check-off system. the Minister for Finance can remit SHA for all public servants from their salaries. Secondly, we have a very inadequate awareness on SHA, despite the 40,000 Kenyans registering every day and above. There is a manipulation of the mean testing tool, resulting in very accurate premium. There are people who take Kenyans and want to guide them, take money from them. I want to tell Kenyans to register for SHA is free. Nobody should charge you anything. And later I'll tell you how to register. I think one of the members of parliament has asked that question. Of course, we are facing challenges of management and reform. It is difficult. People don't want reform. They don't want, this system is watertight. This system is anti-fraud. This system will give you the best affordable, accessible, equitable healthcare. Honorable Speaker, the implementation of the Social Health Insurance Act of 2023, and I want to thank this House and the Senate for making sure all the regulatory laws to run this universal health coverage, you have passed it. I really want to thank through you, Mr. Speaker. That act is still at a very early stage, and most of the challenges that we face are more of operational and do not require legal intervention. If and when that is required, Mr. Speaker, the ministry notes that any need for any legal reform, we will propose the same to the Houses of Parliament. The second question was on how teenage mothers without national ID card. That question, Mr. Speaker, I want to answer it this way. Yes, there are many, many thousands of teenage mothers without national ID cards and indigents. SHA will identify them by a system deployed by the authority and the state measures that we need to put. These teenage mothers, Mr. Speaker, who don't have IDs are registered in all our public facilities, and they are given temporary IDs that enable them to access the service. Either young girls. The government pays SHA premiums for these registered teenage mothers who are given temporary ID. They are given SHA premiums, and I urge this House and other leaders, including our regional leaders, later to have a national conversation on the increasing number of teenage mothers in our country. But they are given temporary IDs, and the government pays their premiums, SHA premiums. For the indigents, and they are found in our constituencies, they are found in our counties, they are found in our country. They will be identified using the data we have by the Ministry of Social Protection, working very closely with the Ministry of Health, the county government, and leaders who sit in this august house using the NGCF method that you have been paying. The national and the county government and the NGCDF, we really want to urge all of us, the national, the county, the resources that you have as members of parliament, let us identify the indigent in our communities, use the social protection data, and let us pay for their SHA premiums for this important segment of our society. You can find this in the sponsors portal. We have a sponsors portal which is available at our website. This portal is known as Afya Yangu portal or app. You can use that if you have 100 and the CDF wants to pay for, you can use that to help the most vulnerable. Under the defunct NHIF, which was up to 6 months, depending on who you know, access to SHA benefits is very instant. As you are going to hospital, you can pay 1 month, You can pay 4 months and you access. So it's not like NHIF where you have to wait for 2 months for the system to capture you. So it's very instant. The third question was the nature of covers offered by the authority at all levels. Honorable Speaker, shall provide services as below. Number one, it provides free primary health care services at all public health facilities, level 2 to 4, and those contracted by the private and the faith-based facilities. And Mr. Speaker, this I really want to thank the House, because free primary health care is paid by government. It's budgeted by this House. And that is one of the things that has never been in our country, and that is why we are saying if you register and you go to level 2 to level 4, the dispensary, the health center, the sub-county, and their equivalents, both in the private and faith-based, you access, you are treated, you get medicine, you get everything, and you work free, courtesy of your government. Additional services that Chief, the Social Health Insurance Fund, for all paid-up members available at level 4 to level 6, and all contracted private and faith-based facilities. Then we have the emergency service, as I said earlier, for all Kenyans. You don't need registration or payment required. Any emergency. For example, a boda is knocked down, God forbid, by a vehicle. He's rushed to a hospital. He doesn't need to register. He doesn't need to pay. Nobody can deny him. No facility can deny him treatment. And he walks away home. This is something that has never been there, but it is in law. Article 43, sub-article 2 of the Constitution, where at the Bill of Rights, require government to do that. The last one, service we offer is chronic and critical illness services for all SHA paid members at level 5 and level 6. The details of these services that the member have asked, Mr. Speaker, are set out in legal notice number 47. The NHIF was not required to publish, but this House allowed us. Those services you can access, and a legal notice number 47 was created. The gazetted benefits are a huge improvement from the previous benefit offered by the defunct NHIF. They are aligned to the projected collections. These benefits we shall continuously improve in tandem with available resources. For instance, Mr. Speaker, this month, SHA and the ministry, we have enhanced the ICU package from 4,000 to 28,000 per day. And additionally, we have increased 150,000 extra for all cancer patients. And that is because of that chronic and critical illness services. Mr. Speaker, the next one was about the referral system. There is 3 levels of healthcare services or access in the referral system as shown below in the document that I've given to the colleagues who asked this question. All registered SHA members, Mr. Speaker, can access outpatient services at the primary health facilities, level 2 and 4, free primary health care fund, which this House has established, courtesy of this House. So they access it for free. Number 2, Mr. Speaker, all inpatient services are accessed at secondary health facilities, level 4 to level 6. SHIF, which is the contributory arm of the universal health care or the Taifa care, and paid by Kenyans, is the where you can access those level 4 to 6 inpatients in those facilities, both public, private, and faith-based. For indigents, They will be paid by government of Kenya. They can be paid by our members of parliament through their NCGF. They can be paid by our county governments. They can be paid by Good Samaritans and sponsors. And the last one is all specialized services are accessed at our tertiary facility, level 5 to 6. That is where we have emergency, chronic, and critical illness, which is again, courtesy of this house, is funded by the government of Kenya. So this referral system, Mr. Speaker, is aimed at decongesting the specialized facilities to allow them to focus on the provision of specialized services as contemplated under the Health Act of 2017. Mr. Speaker, let me explain this. Why do Kenyans go to India, to other countries to look for specialized facilities? It's because our specialized facilities, like Kenyatta National Hospital, like Moi Teaching and Referral Hospital, like Kenyatta University, are full with the patients that can be attended to at level 2, at level 3, at level 4. Somebody with a headache will go to Kenyatta Hospital. Somebody with malaria will go to Kenyatta Hospital. Somebody with a small scar accident. Our specialized facilities should be for special cases so that we stop Kenyans going out to look for special facilities. And I really want to ask this house to support me that the men and women who work in our specialized facilities should attend to Kenyans who require special needs and not for ailments that can be done at the other levels of our health system. The other question was on the empowerment of the health facilities. How do we know this is a health facility? How do we grade them? How do we find a facility? Unlike before, Mr. Speaker, a facility now must be licensed by the Kenya Medical Practitioners and Dentists Council and the Clinical Officers Council and all other regulatory bodies within the health sector. They must tell us this facility is at this level. This facility has all that is required to be part of the universal health care. So these facilities must be licensed by the regulator. And if the regulator is the one who audits these facilities, if the regulator feels this facility is not level 4, is level 3, then the regulator will stop and will advise SHA. Secondly, and more important, and NHIF, Mr. Speaker, used to accredit facilities itself, making facilities to pay for them to be empaneled even after being licensed. So it was who you know, it was how much money you pay for your facility to be accredited by the defunct NHIF. Now it is different. And when I had a meeting with the Council of Governors, we still had about 2,900 primary health facilities which have not been licensed, which we have asked them to give us the names which they have already provided, and the Kenya Medical Practitioners and Dentists Council and the other regulatory bodies within that sector will. The approved SHA staff establishment, Mr. Speaker, is a question that I was asked, is 815. And in line with the first schedule of the Social Health Insurance Act that this August House has passed, SHA has advertised positions and is giving first priority in the act that you have passed. The first priority will go to the employees of the defunct NHIF. NHIF staff who are not absorbed by SHA, because SHA is more of technology driven. The number will reduce. Those staff will be deployed within the public service. No one will lose their job. But let me do it with a rider. Your certificates must be genuine. If you are working at NHIF and your degree is fake, we will not only not post you to any other place, but we will refer you to the institutions within the criminal justice system that have done it. And we already found a number of them. The number, Mr. Speaker, corruption has permitted until people don't want to go to universities. They want to buy degrees. So please, members of parliament, I am sure many of you have approached me, telling me we have so and so working. Before I deal with those cases, ask your constituents who are working at NHIF, and I'm sure they're watching me. If their documents are in order, nobody will lose a job. But if your documents are false, they are fake, you better not wait for me. You better resign now and just go home, because we will not carry when you have joined NHIF. In fact, we will surcharge you for all the salaries that you are paid by the former defunct NHIF. The other was provide a detailed report of the current capital capitation. SHA has not received any capitation or monies from SHIF. SHIF has not received. As we said, we have two. There's a difference between SHA and SHIF. The insurance component has not received any capitation or monies from the exchequer. SHIF is a contributory and self-financing. Mr. Speaker, if you allow me, because the member has the table, which I have explained very well. The other question was how the monies that have been utilized in the organization of the fund. Mr. Speaker, all monies collected so far are used to settle verified claims. Let me stress the word verified claims. All the previous claims of the former defunct NHIF, which have not been paid. Some are with the former Auditor General's Ouko's task force, who is looking at the bigger picture of the 500 billion pending bills. But I have set up a verification team for all the pending bills between July 2022 up to when we took over this administration, up to 30th of September 2024, when SHA took over. And we have made a commitment, Mr. Speaker, and we will seek for that budget. Anybody who bills have been verified and they're between 0 to 10 million, the government of Kenya will pay, and we will bring that to the budget committee and to this house to seek that money. The rest, we have formed that committee. So, Mr. Speaker, all the money that we have so far collected, we have used to settle the verified claims which have been verified, which are. Speaker, I really want to bring the house, and this is good for the country to know. During the NHIF time, today, and this house has capped the administration cost of SHA at 5%. What was the administration cost of the defunct NHIF? At one time, it was 40%. That's why many people were employed. That's why money was everywhere. That's why there was fraud. By the time this administration was coming to office, the administrative cost of the former defunct NHIF was at 17%. Today, because of technology, the administrative cost, and it's in law, of SHA is at 5%. Proper measures have been put in place to ensure, Mr. Speaker, proper verification of SHA claims is done as follows. All patients are verified using the National Registration Bureau data identifying biometrics. Mr. Speaker, this system is linked to NRB. This system is paperless. SHA will not give you a card like NHIF card. You walk to a hospital, if you are registered, because we have integrated with the National Registration Bureau. When you are taking your ID, we had your 10 fingerprints. So when you put your 10 fingerprints, then the system will show you. So, and this is so important because we want to identify the person. Mr. Speaker, before you go to a hospital, the hospital can take instead of taking 10 fingerprints, that hospital, that place, they can take 7 of your fingerprints. And the other 3 was used for fraud. Where, for example, Honorable KJ can be sitting in this house, but maybe somebody has used his fingerprints and is admitted in a hospital for 5 days, and that facility is paid. So this system is integrated to the National Registration Bureau data. 2, the SHA system is integrated with the systems of all regulators, the Kenya Medical Practitioners and Dentists Council, the Nursing Council, the Clinical Council, among other health workers. We will know from the system who is the doctor treating you. There will be no more Dr. Mugo in this country. And you know Dr. Mugo, what he did to many people. And it's from Dagaroti, the member is saying. We will know the doctor who did the surgery. And the speaker, I'll give you a good example that we have seen. Crazy thing, for a doctor, a surgeon to perform hip replacement, he needs, and there are doctors in this house, he needs 8 to 12 hours. Under the former defined NHIF, we had a facility that had a doctor who performed 10 hip replacement in 1 day. That must be a very meticulous magician doctor. Now it will not happen because the Kenya Medical Practitioner Dentist Council, which Dr. Golicha is a member, we will see Dr. Golicha has treated, and if we see he is not the one, then that payment will not be made. The Nursing Council, we know which nurse is treating our patients. We know which clinician is treating. So all their database, if their license is canceled because of malpractice, then the system, through these bodies, it will delete him. The Speaker, and that is to ensure the correctness of the facility and the doctor providing the service. Even the facility are identified by the regulators. The Speaker, a claim verification office with qualified doctors has been designated to undertake additional verification and settlement of claims. In fact, the leader of the claims department, most likely, I don't preempt, when recruited, the director must be a medic. All SHA claims, Mr. Speaker, as I said earlier, are settled by the 14th day of every month. All claim status are available at our facility portal. Every facility, every claim can be seen on the dashboard. The other question, Mr. Speaker, was state the current liabilities of the fund. Because Honorable Wajiko had many questions. Mr. Speaker, the ministry has appointed a verification committee to review the claims and make recommendation on the same to be settled within 3 months. Mr. Speaker, I was very clear to the verification committee. If they allow and present a fake, fictitious claim, Mr. Speaker, they will be held responsible. Clarify how SHA is enforcing the payment of contribution by employers. Speaker, SHA sends reminders, SMS, every 15th and 30th of every month to employers and employees. SHA has also designated officers to follow upon on the payment of the contribution. Finally, Mr. Speaker, State the percentage of the SHA funds that shall be paid to medical equipment suppliers vis-a-vis public health facility. Speaker, I want to say here, the National Equipment Service Program, known as NESP, is completely delinked from SHA. It's a different program. It is a replacement of the old system known as MES. And I'm happy, Mr. Speaker, if you allow me to engage the House and table a full report of the National Equipment Service Program, which is a joint venture between the national and county government. And so far, 45 counties have signed the IPAs to join the program. Only 2 have not, which I am talking to them. I will update the House on that. So that program, Mr. Speaker, is not part of the SHA. SHA is not paying for. SHA is not a partner. SHA does not know. SHA only pays for its members when they fall sick, when they require surgery, when they want to deliver, when they have cancer, when there is an emergency, SHA and the primary health care. Speaker, I think the last one was provide the status of the primary health care fund in relation to facility improvement.
Minister, you have actually dealt with 2 questions by Honorable Kawanjiku. We'll now allow members to joyride on those before we go to the next question. Yes, let's start with Oundo.
Thank you, Honorable Speaker. And I want to thank our colleague for coming back here. Chair, Honorable Speaker, allow me to ask the Minister 2 very basic questions. And I want to ride on the first question of Kwanjiko, number 2, on the issue of teenage mothers who do not have national IDs. Honorable Speaker, I come from a border county, so in essence, there are quite a number of ladies from Uganda who get married to a Kenyan man. For some strange reason, they don't get IDs, but they get pregnant. So they have to go to hospital and deliver. Yet, Honorable Speaker, they have no IDs, so they cannot get into this program. What measures is the minister or the government doing to ensure that they are attended to like any other person? Second, Honorable Speaker, he has talked about they'll pay for the indigents. When is the government paying for the indigents? So they shouldn't just talk when we will. Decisions cannot wait. When are they paying for the indigents?
Thank you. KJ?
Mr. Speaker, I thank you. And I thank you also for admitting Waziri Duale to this House in an afternoon where we've been talking about experts, and maybe to also showcase that from the UDA party and the Kenya Kwanza side of the House, we also have experts, Mr. Speaker. This is a gentleman who has done an amazing job in environment. We are waiting to swim in Nairobi River, and as soon as he had set up the plan, he's now in the Ministry of Health, where we hope he's going to clean up Afia House. Mr. Speaker, the job that the Honorable Duale has done today is a job of advocacy and sensitization. We have also seen him on TV doing the same. Mr. Speaker, our concern is, today as you speak about SHA, the only story that is out there is about the teething problems. The concern is this ministry having any tangible plans to put up proper sensitization and communication campaigns to allay the fears that Kenyans have? Because the questions that Honorable Kawanjiko has are the same questions Kenyans have there. The information sits at the ministry. However, it does not trickle down to the people. So that even as they're investing on the big plans in the ministry, how does this message get down to the people in Kenya? And finally, Mr. Speaker, there is a big investment in terms of money by Kenyans on making this universal health care work. We are still very dependent on remedies, therapies, and medicines that come from outside Kenya. While we very well know, Mr. Speaker, that even from our traditional medicine, from our culture, we've got therapies that are better than even medicine that we import through KEMSA. Is there a component of the monies that we're investing in this plan going into research and development so that we can be able to develop our own naturally grown remedies and therapies for our country, so that we do not export all the monies that we are raising through this very beautiful program to international pharmaceutical companies. I thank you very much, Mr.
Thank
Speaker.
you. Professor Jaldesa.
Thank
Kawanjiku,
you.
I know I should have given you the first bite. I'll come to you.
Thank you,
Professor,
Thank you, Mr.
Joy
Speaker.
Riders, ask one question each.
I just want to inform the minister that so long as the county governments are on strike, Kenyatta National Hospital and other referral hospitals will be overcrowded with patients who are not supposed to be there. But my question is, when we thought of this SHA, the main thing that we were assured of was that patients' medical bill will not be a bother anymore. It will not be a burden to the society. It will not be a burden to the members of parliament. Unfortunately, most of the disease that people have that gives you very high bill is the critical, chronic, and emergency infectious, which is under CCIF fund. Now, many of our patients have huge bills turning into millions of money, yet SHA can only pay a maximum of 300,000. What steps are you going to make sure that these patients or the relatives who have lost their relatives in the hospital or somebody has been discharged cannot be detained waiting for that money to be paid? Because that is the major problem. We are not talking about level 1, level 2, level 3 health facilities. The major problem people have in this country is public health facilities, level 5, level 6, and they accrue a huge bill. And because they are indigents, as Mheshimiwa Wanjiku said, and yet the relatives, when they want to bury their dead, they cannot be allowed to carry the body until they are paid. And yet these people are paid up SHA members. Thank you, Mr. Speaker.
Give her the mic.
Thank you, Honorable Speaker, for the opportunity to ask my question. And my question, Honorable Speaker, is in regard to the monthly subscription that members to SHA have to pay. Honorable Speaker, when I go around my county, the greatest question I get in regards to SHA is members who are unemployed, the elderly, and those who are self-employed also, asking why we cannot give a flat rate on SHA, where they pay a flat rate of a monthly subscription. Honorable Speaker, I would want to give a very short example in my county, where we have people who rent houses, maybe in the slums, and the floor is concrete, the walls are concrete. When they go for the means testing, they will be charged that they are actually wealthy, yet maybe they are not wealthy as they are assumed. Then we have another group that live in a mud house thatched, but with 1,000 head of cattle, for example. This person will be assumed by virtue that they are living in a mud house, they are supposed to be paying less. Honorable Speaker, my question would be, why don't we have a flat rate for the unemployed, the self-employed, and the elderly? Thank you, and the indigents. Thank you.
Thank you. Bissau.
Thank you, Mr. Speaker, sir. For me, to the CS, we have situations whereby SHA is not working, especially in counties. Trans Nzoia County, where I come from, as we speak today, we've just buried a Miss Alwoj, 21-year-old girl, who yesterday when she was being moved from the morgue, there was a lot of riots. And it's because if you took even the staff from the county, their monies have been deducted, but they have not been remitted to the ministry. So what are you going to do to ensure that such counties, the funds are actually remitted? Number two, there is a collapsed health system. If you look at our Article 187, where one function fails in a government, if it's like county government, it can be moved to the national government. So Trans Nzoia, it has completely collapsed. What are you going to do to help us rejuvenate the health system within Trans Nzoia? And lastly, Duncan Lumumba, a kidney patient, only his dialysis is covered. He's moved from Trans Nzoia, is now living in Eldoret, and we have to contribute for his medicine. Why isn't SHA covering such patients with such an ailment? Thank you.
Thank you, Pauline.
Thank you, Mr. Speaker, for giving me this chance. I have two questions to the minister. First, I want to thank him for the elaborate information that he has given Kenyans on CHA. My question, Mr. Speaker, to the minister, question number one is, what measures is the ministry putting in place to ensure that places that have low registration on SHA are really encouraged and given information so that many community members can register? I can give an example of Samburu County, because if I look at the data of the people who have registered, I think Samburu County is on the bottom. So what measures are you putting in place to ensure that those people uptake SHA and also they get to benefit out of it? Number two, we know that majority of our patients or communities get treated at level 2 and level 3. And Mr. Speaker, we know the situation of facilities at the county levels. The healthcare system at the county levels is really collapsing. You go to any facility, you don't find medicine. The health workers are on strike. So communities at the end of it are not accessing services. What can we do to ensure that at the level 2 and 3, where majority of the community members go for services, really can be empowered to have staff in place, to have infrastructure, and also to have medicine? Thank you, Mr. Speaker.
Thank you. Makali.
With the mic. Thank you, Honorable Speaker. One of the issues that has been identified by the minister as a challenge is manipulation of data by the likely beneficiaries. Is the ministry making use of the community health workers on the ground to ensure that we develop a proper system for identifying the beneficiaries? And two, one of the issues which are also facing are the former NHIF employees. The minister has said we are going to do, those ones who have certificates will be deployed, proper certificates. Has the ministry carried out a staff audit of the former defunct NHIF defunct employees to see whom they are going to absorb from those particular NHIF defunct employees? Thank you, Madam Speaker.
Martin.
Thank you, Mr. Speaker, and I want to thank the CS for the energy has come to the docket. And it is true, Mr. Speaker, if the level 2, 3, and 4 can work, then we can have early disease detection and deal with these diseases and prevent more expenditures. But the reality is, CS, it anchors on two things. One is the human resource for health. And you know very well that the United States government have taken out so many health workers who are in their payroll. That's a fact. A dispensary may have now one nurse. If goes on training, there's nobody. The other factor is the fielding rate for cancer. So we have HR and we have medicine. If those two are missing, then the flare up you are talking about to level 5 and 6 is true. So what measures are you taking as a ministry to ensure that the HR are there and also the field rate for cancer is as needed? Thank you, Mr. Speaker.
Mumbi. Wamumbi.
Thank you, Mr. Speaker. Mr. Speaker, last week we had a debate when we were asking whether a non-teacher person can go with students to drama festivals. And when we asked that, they asked, is Honorable Duale a doctor? I want to confirm today from the presentation and the way Waziri Duale has handled the questions that indeed he is a doctor. My question, yes.
We know he isn't. Just say he's like a doctor.
He is like a doctor,
yes.
Mr. Speaker. Mr. Speaker, my question to Waziri Duale is on ICU patients. We have had a challenge with ICU patients. For example, the PS Public Health knows that I had an issue at Tumotumo Hospital in Madera constituency where an ICU patient passed on with a bill of 1.5 million. and there was a challenge from Shah in settling that bill. So, Waziri, how far are we with regard to ICU patients? Thank you.
Mama Nairobi.
Thank you, Mr. Speaker. To the CS through the Speaker, I want to talk about what Honorable Awanda was talking about. It's children. We know that in Kenya we have a lot of defiled children and a lot of children who engage in sex before they reach the age of 18. We have a serious problem in that if a family has the NHIF, the SHA cards, medical cards, you've got the wife, you've got the husband, and then you've got the children. If the wife has given birth, right, and the daughter 2-3 months later is giving birth because she was defiled, the system has no way of picking that child and giving her the right cover because she's a minor. And we know that during the pandemic, we had over 300,000 minors that got pregnant through defilement. Now, that's problem number one. How do we address giving services to a minor who has been defiled and is giving birth under a medical card that is actually owned by her father and her mother has given birth? So in the same family unit with the same membership number, how do you accommodate that minor to get the right services? The next thing, when it comes to the same minor, this is a minor who's probably 10, 11, 12, who has given birth because of defilement. And the society will look at her as an adult. They will look at her as a full-grown woman, yet she's a minor. By the age of 18, this minor will have been defiled and misused over and over and over again. We buy commodities as a country. I want to know whether you would ensure that that minor is counseled and put into a family planning program so that she doesn't have a child at 13, 14, 15, 16, and then before you know it, she's wasted her life, no education, and she's a burden to her family, and the children are a burden to her. And then we also have a big problem with the abortion guidelines. The court has given a ruling that the abortion guidelines have to be released by the ministry. Could I know whether this will be based on your religious beliefs or whether you as the CS will do the right thing and ensure that guidelines to abortion, which is permitted under the Constitution and has been spoken to by the courts, will be released so that we can have safe abortions where required.
Which
Thank you.
constitution are you quoting?
Article?
Which constitution are you quoting?
Article 26(4) permits abortion.
Abortion is illegal and except under very stringent circumstances.
Yes, but there is no guidelines issued under those stringent circumstances. And the courts have pronounced themselves saying that, Article 26(4), thank you. The courts have pronounced themselves on that issue, that the emotional state of the mother, the emotional state, the physical and the social states are also supposed to come into consideration. There is a live ruling on that in the case of JMM, which I will gladly share with the CS for him to become acquainted with that. I know that the church is fighting it, but right now, if a woman is supposed to procure a safe abortion and the doctors want to do it, there are no guidelines. So doctors don't do it, and the woman dies because there are no guidelines. And yet the doctor knows that this woman should actually have a safe abortion. If you go to KNH right now, in the wing for abortion, medical care for post-abortion, it is full. We spend over 500 million to $1 billion post-abortion care. Women are suffering because of unsafe abortions. Let us be a civilized country.
You are making a speech.
Yeah, okay, thank you.
Minister,
I think the point is.
Minister, can you now respond to those 10?
Speaker, let me start with my good friend, the woman rep of Nairobi. All these abortion, emotions, all these are coming to this house. There is a reproductive health bill that is coming to the house. I'm just going through it, and a lot has been done by Honorable Midi Odhiambo when she was and very passionate. She's very passionate when I was the leader of majority. And there are a number of policies. I will engage you and we. And as the speaker has said, abortion is illegal under certain medical conditions. Those medical conditions, the framework, the director of medical service, the head of the technical advisor on technical matters to government, and the CS is on my left, Dr. Amoth, who this house has vetted. On teenager mothers, I can only deal with the question that Honorable Owundo also has asked. It's more. Teenage mothers is another national conversation. The numbers are huge. It is a conversation, national conversation for the leadership in this house, for religious leaders, but for SHA, we are giving them special temporary cards. They don't need to use their mother. If they deliver on the same day, the mother will use her SHA card and the lady will use her temporary card. Honorable Owundo, I agree with you. I mean, you are at the border, it's very complicated. How do you identify a teenager who crosses from the neighboring country? But I want to assure you that we have a way of giving, even when neighbors cross, they have alien card. So we will use the alien card as we give temporary card to our ladies. On indigents, as we government look at the social health, social protection data to make sure that it's clean, even the elderly people who are getting 2,000, we want to find out, are they indigents? Some of them might not be indigents. Some of them might not even require that. So we are in the process of doing mean testing for the national government and the county governments, and you will help us. Because even in your constituency, you might find indigents that you want to pay either through NGAF or through the national government CDF. Honorable KJ, sensitization, yes. I know you have a communication background, but ask yourself, every day as we sit here, Mr. Speaker, on our dashboard, 40,000 Kenyans has registered as of now. So per day. And out of the 40,000, we can tell how many have gone through the mean testing and how many have paid. Like yesterday, we had 47,000 Kenyans who registered online. 18,000 of them went through the mean testing and paid close to 18 million. So you see, is that the average is about 1,000. But I want to assure this house, because universal health care, we meant for the 80% Kenyans who were not accessing NHIF. NHIF was colonial. NHIF was a club of the salaried people. 20% were accessing. This universal health care, SHA, wants to bring on board the 80%. And that's why we're doing the mean testing. The bottom of that mean testing, the bottom that somebody will pay will be 300. And I want to give an example of Mr. Speaker. The Speaker, I really want you to allow me to use you as an example. If you allow me, Mr. Speaker. Mr. Speaker, you pay NHIF now, I mean SHA, you are paying 47,000. The Speaker of the National Assembly.
47,800.
47, to be specific, 800, based on the 2.7% of his income. The good lady, the maid, the house girl who cooks for him, who earns maybe 5,000. I'm giving an example, Mr. Speaker. I'm not saying you give her 5,000. You might be giving her more, but I'm giving an example. Minimum wage 5,000. I'm just, it's hypothetical. I'm just using 5,000. That lady, if she pays 300 or 500 SHA, and she wants to go and deliver in Pumwani maternity, SHA will pay 30,000 shillings. She will deliver and she will walk home with her baby. she will not pay a coin. Mr. Speaker, if your wife or wives go and deliver at Aga Khan, SHA will pay 30,000 because the first charge is SHA. The 170,000 is what your insurance premium that Parliament gives you will pay. But you have a choice, your wife, to go and deliver in Pumwani. So the rich and the poor must access a universal health care. The choice is yours. So he's paying 47, the speaker is paying 47,800. Indirectly, he's paying for the many who are going through this mean testing. I used to pay, we used to pay 1,700 for those who, if you earn a million shilling, under the former NHIF. That was 0.01%. But when Mama Mboga pays 500 for NHIF or 300, for 500, let me use 500, she was paying 10 times what the speaker was paying. And that's why, for equity purpose, the law you amended and said, for everybody to access equitable, affordable, accessible, quality health care, the formula should be 2.5% of the income that you earn. So, Mr. Speaker, Honorable Udo, my good friend in former Public Accounts Committee, I think indigents for national government, we are rolling out, we are doing the mean testing. And we are using the social health protection database. Honorable KJ.
Malimo, what is your point of order?
Thank you, CS. And you have excited my support for SHA. When you were still the leader of majority in this house, and when we were trying to make the original law of universal health care, you remember I was moving an amendment that the then de facto NHIF becomes the first charge on the medical bills of the patients. I'm so happy to hear, and I wanted to confirm, not just to the House, but to the country, that SHA is the first charge before the private medical cover. Remember, that was my baby then. Thank you.
That was more information than point of order. Yes, Millie?
Thank you, Mr. Speaker. I'd actually pressed the button earlier, but I thought you wanted to let the CS speak a little more. Mr. Speaker, I just wanted the CS, in speaking, he referred to a reproductive health bill that the ministry has. Mr. Speaker, I just wanted him to clarify on that because I already have a bill, reproductive health care bill, which then, pardon?
Order, Professor.
I know
You are
Professor
out
is
of order.
confusing. Actually, I have a bill which has appeared before their committee, which is assisted reproductive healthcare bill. That deals with only assisted reproduction. But I have family reproductive healthcare bill, which is comprehensive. The reason I'm asking that, Mr. Speaker, is so that we don't waste human resource time, either theirs or mine. If they have a comprehensive bill, me, I don't have a problem. I can give them my ideas. We are in the business of giving expertise. I've given the Minister of Children Affairs before, but I need to know if they have and where it's at, because mine is pre-publication, the family reproductive healthcare. A lot of research has gone into it. And so I would like to know if they are serious about it, if then the way we can go about it, so that we don't waste either their time or my time.
Minister,
Mr. Speaker, this is my 15th day at the Ministry of Health, and I want to assure Honorable Millie Odhiambo, your bill plus the ministry's bill, your good ideas, we have combined. It's at the AG's office, and you know me. I'm going to fast track, and when it comes to the committee of the whole house, please, if there's anything we have left, you will propose. Reproductive health bill is very important. Yes, so I will push it. Honorable Jaldesa, Dr. my good friend from the north, I want to confirm to you that no Kenyan will be or should be detained as long as they have registered with the SHA effective 1st of April this year. And a thorough budgetary allocation has been provided under what you did in this house, the ECCF. And this has enabled facilities to be reimbursed. For example, we have increased cancer, critical cancer to 550,000, to ICU to 28. And I want to give an example, because there was also another case of ICU. Now, if you have a patient in hospital and your bill is 1.1 and SHA pays $500,000, is that a very progressive healthcare? That was not there during the defunct NHIF. I think there was also the one of teenage mothers I have answered. Honorable Speaker, on the strike by Dr. Jaleza. I want to assure him that the success of the universal health care or the Taifa care is how we handle the human resource aspect of our health system. That's why I've met the KMPDU leadership. That's why I'm sorting out the issue of internship in consultation with the county governments and the presidency and the National Treasury and Parliamentary Committee on Health. That's why I met the universal health workers, and I had a meeting with the Council of Governors. And Kenyans must talk to each other. They must not talk at each other. There is light at the end of the tunnel. We want the doctors, we want the nurses, we want the clinicians, we want all the health workers in our country to be the champions and the promoters of universal health care named Taifa Care. Honorable Kagiri asked about mean testing, flat rate. There's nothing called flat rate. We must assess. The bottom is 300. There are those who cannot even pay 50 shillings. So we must pay for them. So we don't want those who can pay 800 or 1,000. And that's why we have put this system as you can pay a month, you can pay 2 months, you can pay 3 months. Those who can pay must pay. Those who cannot pay, then the rest of us is a pooling system. That's why the speaker is paying 47 plus. That's why members of parliament, I'm sure they're paying 32,000. That's why Mama Mboga will pay 300. Even within the Mama Mboga spectrum, there are those who have a kiosk. There are those who are carrying their merchandise on a mkokoteni. So there are different levels, but pooling the resource together will give our people a universal healthcare. But above all, the 21 million Kenyans who have registered, at a go, they can access any primary, public, private, faith-based health facility, free of charge, budget allocated, appropriated by this House, Mr. Speaker. Mr. Speaker, there was an issue of by Honorable Pauline on registration, Samburu being bottom. There are a number of ways you can register. If you have your iPhone, or if you have a phone which is Android, please go to www.sha.gov.ke
Mr. Asamburu Herdsman.
I'm
Is
coming
that-
to it.
is that
I'm
like-
coming to it.
Yes.
I'm sure I'm giving the four. If you wait, those who don't have phones, like the herdsman, like the ones who look after my own camels, Mr. Speaker. In every village, we have 107,000 community health workers. In every village in Kenya, you go to them, they will register you. Those who have kabambe or mulikamuizi, they just need to do *147#, you are registered. Those who have computers, those who have iPhones, we are upgrading an app on iPhone in the next 1 week. So there are many ways you can register. You can walk to the nearest Huduma Center. You can walk to the nearest SHA. So Honorable Pauline, I think, and then we'll make sure our counties, I agree with you, our counties, and when you go to Saburu and many others, you are sitting next to my member of parliament. This weekend, that's why I'm here, Mr. Speaker. This weekend, I want the members of parliament to be also helping us register. Yesterday, I asked the Council of Governors, let us publish the 10 counties, the best counties. And I want to thank the leadership of Mombasa County, and Nyeri, and Bomet, and Kirinyaga, and Elgeyo Marakwet, and Kericho, and Nandi. Mombasa, and my sister, the woman Rebizia, the governor and the leadership took deliberate. Today, 59% of the people of Mombasa have registered SHA. Bomet, Kilifi, as a county, I've agreed with the governor, so they only allowed me to say the top 10. But from next month, every month we will do 10 counties. We are starting with Kisumu and Migori. And then we do every of the former 8 regions, we do 2. We'll do Kilifi. We will invite the first day all the leadership, Mr. Speaker, from the governor all the way to the MC and our members of parliament. I will be there. So that we tell our people to register en masse. Already they are registering between 40 and 50,000. But some counties are lagging behind. I'll give an example of number 2, which is Bomet. Out of our target population of 875,000, 426,000 people in Bomet County have registered for SHA. So SHA is working, and it's helping the people of Kenya. Don't listen to the naysayers. Honorable Bissau, you talked about Trans Nzoia. You talk about county governments. Today, I want to report. Before, during the NHIF defund, the private hospitals and the faith-based used to lead in terms of numbers. But today, 51% of Kenyans are accessing public facilities, more so level 2 to level 4 in our counties. The reason why? The drugs are there, the doctors are there, the facility is paid. We are not paying the county treasury. The facility is the one that is paid by SHA. And they claim it from SHA. So I think maybe that county is one of the counties that we shall visit. Minus politics. Minus politics. The lives of our people. Every leader, beginning with the president, the lives of our people is our constitutional and moral duty. Let us, at least for some time, I really want to help you. Even me, I think for the next 6 months, I will only talk about health and health and health. There are many, many other issues of health. But today I decided, let us deal with this. I didn't get the member for at the far end on the manipulation of the NHIF and staff audit. Yes, I said we have over 800 NHIF staff. In your own act, the SHA Act, you stated it that the first priority is given to the NHIF staff. In a competitive recruitment, to make sure their papers are in order.
Yes, yes, Ferdinand, what's out of order?
Maybe it's just an input, but it's like a, Waziri,
Under what standing order are you making an input?
no, all I wanted to find out is a program, specific program. I think you talked about him going around, but I want him to come out very clear. What programs, apart from what you are saying using health workers, what specific programs are you putting in place to be able to educate the people on the ground to be able to register themselves with the SHA? Because it's important and you are doing very well. But what specific program do we have? That's what I want you to tell me, not you going around.
Mr. Speaker, this is the first program I'm doing. I am talking to the leadership of this country. This is a very serious program. It has never been done. I am talking to 349 members. Even those who are not here, they will read the answer. There are many Kenyans who are watching me on TV. That is a program. As I told you, we will do a rollout for 13 counties. 13 counties. Western Province, we will do Kakamega and Bungoma. We have already done Elgeyo Marakwet and Nandi. We are going to do Kilifi. We are going to do Garissa and Wajir. We have done Embu for Eastern Province. Those are programs, Honorable Member for Kwanza and my old friends. So by talking to you, you'll help me talk to the people this weekend. And thank you, Mr. Speaker, for giving me this opportunity, because I think this is the best program. Honorable Speaker, my good friend, the Honorable Member.
Hold on, what is the problem?
Speaker, I just want to ask the Cabinet Secretary. Actually, the main saboteurs of this program are the staff of NHIF. Many times when you go to the offices, they say they have no idea at all what this SHA, chief or chief, whatever they call it. What measures is the Cabinet Secretary and the entire system putting into place to educate and learn and encourage the NHIF staff to take over this program as if it's their own? Thank you, Honorable Speaker.
Speaker, if you could have allowed me first, I finish the questions. But we have a program for NHIF. This House passed a law that they should be given the first opportunity. We have five directors. Already we have appointed 4 who are from within NHIF in a very competitive recruitment. But don't use the word saboteurs. Saboteurs is a big statement. Why are they fighting the system? Because they were used to fraud. I'm not saying all NHIF staff. There was a fraud from the facilities to inside trading within NHIF. And that's why we felt technology will solve all these problems. We must secure the health of our people by making sure the facility is right. And I'm coming to the issue how we are going to deal with the KEMSA. Somebody has asked on the refill. Our health workers will not be in the streets, and they go and serve the people. So, Mr. Speaker, Honorable, we not ask that question on human resource. I want to assure you that a stable, firm, solid healthcare workforce is the success of SHA and is the success of universal healthcare. And we are committed to that as a government. USAID, I have many other questions. I've asked the Speaker, what happens to the many programs and staff who are under the USAID with the coming of the new administration in that? I'm going to answer. But in the next 5 years, this administration has put in place, and I'm sure the budget office knows, that we will recruit 20,000 new healthcare workforce. On KEMSA field rate, at the moment, I think it's about 47. For us to succeed, we must take the fill rate in terms of drugs and equipment at KEMSA to 90%. And we are finding a way of how to partner with the financial institutions to support KEMSA so that drugs go to the last mile, last center is done. I think, Honorable Speaker, the last one was the member for Madeira, a very good friend of mine, an active member. You talked about the ICU, yes. That is why we increased the ICU from 4,000 to 28,000. During the fund NHIF, ICU was zero. They were not paying for ICU. They were not paying for surgeries. They were not paying for cancer. Their payment for maternity was very low. So there are more benefits that Kenyans can get under SHA for them to live a healthy life. And this SHA, our universal health care, is meant to give us an equitable, a more quality health care, and more affordable. Honorable Speaker, I think, unless I've forgotten, I have done most of the questions.
Yes, KJ, you are out of order.
Oh yeah, the second question I think was on, I am not a herbalist, and neither am I a doctor, and I want to confirm to the House. And if you look at how many ministers were doctors at MOH, one of the best ministers was former President, late Mwai Kibaki. In fact, in the last 15 years I was in this House, I think apart from Dr. Mailu and Dr. Deborah Baraza, the rest were not doctors. So I was not an environmentalist when I was the Minister for Environment. I was not from the military when I was the Minister for Defense. The minister's function is cut out, is about policy and direction and leadership. So you asked me about, in KEMSA, what we are going to do, Mr. Speaker, just to wrap up, there will be track and trace. Pharmacy and Poison Board is also part of this super highway technology. We will find every drug that is procured that comes to our market in our country is a drug that is not counterfeit. And I want Pharmacy and Poison Board leadership to listen to me. It will not be business as usual. Mr. Speaker, I want to give you a good example. Why is maternal mortality rate in our country very high? Why is it very high?
Yes, KJ.
Mr. Speaker, the minister has forged a question and attempted to answer a question that he did not ask. I asked a question that was in line with the bottom-up economic transformation agenda, of which the minister is one of the proponents, initial proponents of the Better program. And I was asking, the massive investment that Kenya will make on the SHA program, is that money going to contribute to continue the extractive economy that Kenya has suffered in importing medicines that probably Kenya would be able to manufacture? And the question was, out of all the investment that we will make as a country, is there going to be a component that is going to be assigned to research and development of locally produced or generic medicines that can be produced here to promote value addition and manufacturing in this country and save us forex and also contribute to our national GDP rather than export these monies to international pharmaceuticals? Thank you very much, Mr. Speaker.
Mr. Speaker, that question is a different question. It's not very much related to SHA, because SHA, our main focus is how to increase the refill rate of KEMSA, a government institution. But as a country, I agree with you, we must empower our pharmaceutical manufacturing plants. And this House has an obligation, when you're dealing with a finance bill, to increase duty on pharmaceutical products that come from outside and protect the local pharmaceutical companies. Give an incentives for them to produce. But from where I sit, I want to make sure within the chain that the facility is right, the doctor is available, the drugs are available, mainly from KEMSA, and the days when you could steal the drugs of KEMSA and put it in a private hospital is not there, because we follow, like the primary health care. level 2 to 4. During the NHIF defined time, the speaker, it was only telling you which facility do you want to use in your locality. Now you can be from Nyeri, and if you fall sick in Garissa or in Turkana, you go to the nearest primary health facility because your data and everything. So we follow the patient and we pay after the patient is treated, after the patient has been dispensed with the drugs, after the patient is discharged. So this system will make sure that even those who are contributing get value for their money, and this pooling resource together from the lowest who can pay to the Mamamboga who's paying 300, the one who's paying 500, the one who's paying 800. Members of parliament who are paying more. When we pool these resources together, then we cover the 80% of the citizens of our country who are not covered by NHIF, which in my own opinion was very colonial, was a private elite salaried club when members of parliament and other leaders, we had many Harambis. So we want to make sure that there is healthcare. And the speaker, finally, if we sort out the healthcare of any nation, for example, our country, and we sort the education of our country, Kenya will move from a developing country to a developed world. The two main indicators, the prosperity of a nation is found in the health of its people. Thank you, Mr. Speaker.
Njiku, the owner of the question.
Thank you, Honorable Speaker. I think I'll just add one. Majority of the questions that I would have wanted to raise have been raised by members. But I have a question on primary health care and the quality as the CS is talking about. We have realized that the money that is supposed to go to these hospitals, the county government, and I don't know whether they have been able to establish that system and how that system will operate between the county government and the national government. Because the reason why we are paying excessively is to make sure that we get quality health care in our primary, in our level 1, level 2, and level 3, and level 4 hospitals. But as it is, Mr. Speaker, in those hospitals that we are really paying a lot of money, there are no drugs, there are no doctors. I have a level 4 hospital in Karori Hospital, Mr. Speaker. When you go to that hospital at 7, there are no doctors, there are no nurses, and we're expecting that we're going to give them quality health. It is not impossible. There must be a way that the ministry is able to secure and track the money, the resources that they are sending to these hospitals, that they make sure that there is prudent use of these hospitals between the county government and the national government, Mr. Speaker. In a case scenario yesterday, and that's why we are saying we are paying expensively so that we can avoid many harambes that we normally cough out money during weekends. Yesterday, I had an issue of a patient who has been, who was sent by Kenyatta National Hospital to go and seek for a colonoscopy kind of, to go and seek services outside the Kenyatta National Hospitals because their services, their machines are not operational. And I had to cough about 20,000 shillings to that patient. She's also telling me you need to follow up because I cannot be admitted. And you know, when you deal with that kind of a patient is above level 1, level 2, level 3, level 4. But still, that quality healthcare we are talking about cannot be realized even in the hospitals, Mr. Speaker. So the minister should make sure that there is a serious following as far as these resources are concerned to make sure prudent use for the transfer of the function. Thank you.
Thank you. Minister, response to that?
Mr. Speaker, this House has passed a law called Facility Improvement Fund Act. That act, Mr. Speaker, has allowed the county hospitals or facilities the honorable member is talking about to receive monies directly from SHA without passing the county revenue account. So we have a safeguard. 2, for example, your constituents or a Kenyan cannot get the right drugs and the right doctor at the public facility at the level of primary health care. You walk to the nearest faith-based. You walk to the nearest private facility. So you have a choice. But I want to assure this House, the way you yourself have passed a law called the Facility Improvement Act. So there's no way, and it's good to be honest to the country, there's no way counties, and I want us to remove politics from this. And SHA will only pay for the number of people who visited that facility. So if there are no people who have visited the facility, you get zero. But for example, the closest facility, public facility, the patient is not happy. He has an alternative. He has a choice. He can go to the faith-based facility. He can go to the private facility, which is of equal level within the reading of the primary health care, level 2 to level 4, Mr. Speaker.
Yes, what's the point of order?
Mr. Speaker, I have no question, but I just wanted your direction. We have quite a number of questions in the order paper. Are you able to help us in terms of how to proceed?
I was going to give direction.
Okay, thank you. Thank you, Mr. Speaker.
Yes, Kagusha.
Honorable Speaker, thank you very much. I just want to first say that Mukurweini constituency.
Hold your horses, take your seat. You are hijacking the floor. I was going to give direction on how we go to the next. We are finished with Kawanjiku's questions, so we want to go to the next. Take your seat. You will have an opportunity. Members, we have now done about 2 hours with this minister. The next questions are 2 from Samuel Chepkonga. If we have joy riders in the same manner, we'll probably go up to 7:30 something. And we have other businesses to transact. Can we agree that we take one of Chepkonga's questions? I allow joy riders, a few of you. Then Basil will joyride on Chepkonga. Then we can get another time for the minister to, but so far on SHA, he has done very well. At least he has given a lot of material for those who care to listen. What do you think, members? Yes, Basil?
My question is actually related to Kawanjiko's, and is actually in the order paper. So that's why I thought we should finish up with the SHE, that is SHA and the SHIF. We are done with that.
Chepkongas are also related to the same thing. So let's, Minister, let's take Chepkonga's questions. Can you? Yes, then Honorable Basil, you can actually come on alongside Chepkonga and your question will be dealt with. So let's have Chepkonga. Yes, Mutuse?
The Speaker, my question is listed just immediately after Chepkonga's.
Let's see how well we do.
And I was thinking, Mr. Speaker,
yes,
just riding on your direction and your wisdom.
Yes.
Because none of us has the experience you have, that when you drop Chepkonga's one question, then you can also direct that mine also be heard this afternoon. Because mine is very short.
Chepkonga?
Thank you very much, Speaker. Speaker, I will not read all the questions because all the questions have already been supplied to the minister, and I'm sure he has the answers. The only thing I wanted to say, Mr. Speaker, is to congratulate the minister for being appointed as the Minister for Health. Mr. Minister, I see people have been grumbling here as to whether Mr. Honorable Duale is competent. You know, I am a student of leadership, Mr. Speaker. And in my class, I was taught that to be a leader, you need three critical things. Number one,
You are consuming valuable time.
no,
that
I'm
I've given
finishing.
you to
No, I'm
ask your
just
question.
supporting him. I'm just that you need
Yes.
ideas, people skills, and technical skills, and you can delegate the last one, Mr. Speaker. And I see he has the two very important ones: people skills and ideas. Mr. Speaker, I wanted to say this before I answer the question. Number one, Mr. Speaker, there was animated discussion here in the afternoon when we were discussing the question of NGCTF. As you know, this matter is pending in court. It appears that some people thought that this money is being remitted to the parliament. It is not being remitted to parliament. The law is absolutely very clear, Mr. Speaker. And I think there is a misnomer. When the people hear us canvassing things for our constituents, Mr. Speaker, Article 94, which I must remind them, Mr. Speaker, using scripture. 2 Peter chapter 1, verse 12 says, remind yourself of these things, although you know them. I want to remind them, Mr. Speaker. Article 94, 5 of the Constitution says, members of the Parliament or National Assembly deliberates on and resolves issues that are of concern to the people, Mr. Speaker. Mr. Speaker, there is no one else in Kenya who has been arrogated that power. And that is the reason why we are here this evening, Mr. Speaker, resolving issues that are of concern to the people with regard to health. We were resolving issues that are of concern to the people regarding education, Mr. Speaker.
Which question are you asking?
No, Mr. Speaker, this is a general comment. There are some people who are misled, Mr. Speaker. Mr. Speaker, I want to thank you very much because, you know, SHIF and SHA, they have a lot of similarities.
The point you have
NGCTF.
tried to make,
Yeah.
I think I made it at the end of
Oh,
Mondays.
you did. Sorry, I walked out, Mr. Speaker.
And Monday's appearance.
Yes.
And that you are not owners of CDF. And you should not
Absolutely.
create that impression.
Absolutely, Mr.
So
Speaker.
go ahead and.
So
ask
I'm
your
sorry.
question.
I'm sorry that, you know, I know you are very competent lawyer, Mr. Speaker, and I know some things will not pass you.
Yes.
Although you have nominated me as one of your lawyers
Yes.
for purposes of these NGCTF issues in this house. Mr. Speaker, Mr. Speaker, I would like to ask the question to the Cabinet Secretary. And I will not read, Mr. Cabinet Secretary, please, when you answer all of them.
Just say, I beg to ask question 004.
Yes, I beg to ask
2025.
question 009 of 2025. No, sorry. 004, Mr. Speaker, I was almost ending up with, this is a problem of people sitting behind me who have questions also, Mr. Speaker, the Honorable Milemba. Mr. Speaker, I want to ask question 004 of 2025 and 009 of 2025, Mr. Speaker.
005 or 9?
005 and 004, as
Yes,
listed
on the
in
order
the
paper.
order paper, Mr. Speaker.
Basil, can you also ask your question in a similar manner?
Thank you, Mr. Speaker, and thank you to the CS for a very elaborative response that you have received this evening. My question is 017, 2025, that I want to ask to the CS. Do I read all of it?
I just gave you direction, Basil, and you.
Okay, 017, 2025.
Yes.
Question 1 or to question all the way to question 3.
Thank you. So, Minister, answer those questions 004, 005, and 017.
Honorable Speaker, let me start with the questions by the Honorable Chepkonga, an old colleague who I've learned a lot from, and he learned a lot from me. Honorable Speaker, this question, and you're a seasoned lawyer, the issue raised in this question is subject of a matter of ongoing judicial proceedings under petition number E513 of 2024, Okia Omtata and 2 others versus the Cabinet Secretary, Ministry of Health, and 7 others, and cannot thus be, in my honest opinion be deliberated on until a final determination is issued by the court. Discussing or commenting on the same could consequently amount to sub judice and could prejudice the outcome of the matter. And I cite, Honorable Speaker, with your permission, Standing Order 89 of this House and various rulings of speakers, including you, that we have the answer, but we don't.
05. Chepkonga, I'm sure you. Yes.
By the standing order, he just needs to state the case number, not the
He
parties.
has just done so.
He stated only the parties, Mr. Speaker.
No, he said he read the petition number.
You did.
He did.
Sorry, I was waiting for you to respond. I thank you, Mr. Speaker.
Honorable Speaker, Honorable Chepkonga will never change.
Go to 005.
So let me go. But it is petition
Chep-
number E513.
Chepkonga is just teasing you. Go to 005.
Thank you, Mr. Speaker, for protecting me. Honorable Speaker, the question by Honorable Robert Basil was why Kenyans require to register for the social
I thought
health.
you said 004 is the one that is being litigated on in court. 005.
Yes.
You can answer.
005.
The 104 billion investment system.
It's the same. Mr.
It is
Speaker.
the same one.
All the questions of Honorable Chepkonga are all on this matter of the court.
So go to Basil.
Honorable Basil is asking why Kenyans are required to register for social health insurance fund despite formally contributing to the defined NHIF. Honorable Speaker, Kenyans who are contributing under the defined NHIF and who have clean records were transitioned to SHA. There were 9 million Kenyans who transitioned to SHA out of the 12 million records in NHIF. And they only needed to do only one thing for you to transition. You just dial *147#. Automatically, your NHIF registration goes to SHA. There were 3 million, Mr. Speaker, and I'll explain later. This registration, all other Kenyans who are not members of NHIF, the defined NHIF, the 9 million, are required to register afresh with SHA for the following reasons. Number one, Mr. Speaker, we want to improve accuracy and integrity of the member data, to clean the NHIF database and align it to the National Registration Bureau so that there will be no more fraud in the healthcare system that is being managed by SHA. We must register Kenyans. Two, the NHIF database, Mr. Speaker, had 12 million members. 3 million of these were found to have fake records, including their biometrics were fake. So these are the people who are siphoning, who are being used, who their biometrics were being used for insurance fraud. Two, Mr. Speaker, why are you asking other Kenyans to register, apart from the ones who we transited to SHA from NHIF? We want to prevent fraud, and we want to have an inclusion of a very fictitious beneficiaries, and just establish a source of truth for the identification of all Kenyans. Today, we will use your national registration biometrics. When you took your ID, we have the database. So this system has that database. If it is treating X, it is treating X. The days when, and this I have to make it very clear, the days when your card can be used by or use your daughter's card and you're not registered, it won't work. The system will lock you out. And even if you're treated, the facility will not agree. Two, Mr. Speaker, we want to improve the free primary health care at level 2 and 4 funded by the Exchequer. This House has budgeted to fund the free primary health care at level 2 to 4, which is funded by the taxpayers. The registration will support in the identification and verification of members who are eligible to access these services, and this also assists government and also parliament, both in planning and budgeting for the provision of free primary health care. This year you have budgeted 18 million. If the number at the rate it's growing every day increases, this House will use that number to budget for the free primary health care. The Auditor General will use that data. And that is why we don't want every coin will count. That is budgeted and appropriated for the free primary health care. Finally, Mr. Honorable Speaker, it will bring equity as envisaged in a Taifa care model. We want to democratize access to health service in a manner that all Kenyans have a right to access primary health care services regardless of their social status. And that's why we need people to register. And I really want to ask colleagues here, my former colleagues, who some of them, I was their leader. Please help me, and I'll come to your counties, and we will invite you at all the functions we have, at the funerals, at the weddings, CDF launch of bursary, NGAF launch of bursary. Let us ask Kenyans to register first. If they register, first they will access the free primary health care, free of charge, at the dispensary, at the health center, at the sub-county hospital. If you are not happy with the public facility, go to the private facility. If you are not happy with the private facility, go to the faith-based facility. This is free. It's from the Exchequer. It is this House which has. And that is why Nyeri County is number 3 or number 4, I think. I'll check it. Despite many opposition. It's number 3, in fact. Mombasa is number 1. Bomet is number 2. Nyeri is number 3. And I really want to thank those governors. And many of other governors will pick up. And all of us together, we will help. Honorable Speaker, Kenyans are encouraged to register, add their dependents, spouses and children, pay their contribution to enable them to access full benefit. Under SHA, for example, Mr. Speaker, this question has not been asked. Under SHA, Kenyans can add a maximum of 4 spouses and no limit of children so long as there's a proof that that child belongs to you. So if you have 4 wives, I'm sure that I don't think whether you can contain.
Angela here to hear that.
In fact, yes, the biggest beneficiary of this House is Honorable Wanjala. And many other Muslim members of parliament, Mr. Speaker, they are not here. But this is the good news. But the children, there's no limit, as long as you want to approve.
Yes, Oundo.
Speaker, with your permission, allow me to relay the message to my neighbor, Honorable Anjala, about the statement about the CS. He's my neighbor and also my brother-in-law. I'll gladly relay the information. Thank you,
I know you're
Honorable
also
Speaker.
in the same group.
No, I'm not Honorable Speaker. God only gave me energy for one woman.
Okay. Finish up, Minister.
Honorable Speaker, so how do you register your spouse? How do you register yourself? How do you register and add your dependents? A person, Mr. Speaker, is very simple. Can visit www.sha.co.ke. You can dial star hash 147, star 147 hash. You can reach out to the nearest community health promoter if the person does not have a phone or is unable to read and write. For those of us who have Android telephones, you can download the Afya Yangu.
That material is already on record.
It's on record.
Yes.
Honorable Speaker, I think the other question was payment to SHA. Payment to SHA grants Kenyans additional benefits, Mr. Speaker, mostly inpatient services under SHA. These benefits will kick in immediately, and I think even Mr. Speaker, that one I've also said it. It is under record. For the employed Kenyans, you complete the registration, be declared by your employer, you remit over the remittance of the contribution by the employer by the 9th day of every month. For the informal sector, Honorable Speaker, they complete the registration, they complete the mean testing to decide on the payable premium, and they make payment through the same channel for registration. As of April 15, 2025, Mr. Speaker, a total of 4.386 million Kenyans have successfully completed the mean testing. The average number of Kenyans completing mean testing and making contribution every day is 20,000 per day. The average contribution currently stands at 590. They're paying about 590 for those who are registering and who are paying. Honorable Speaker, finally, as of April 15, 2025, SHIF paid members up was 5.6 million who are paying their contribution. 4.192,744 are from the formal sector, employed, and 1.4 Kenyans, including Mama Mboga, 1,423,000 are from the informal sector. Honorable Speaker, the last question of Honorable, I think Honorable Basil, I have answered. Just to wrap up, with your permission, Honorable Speaker, I really want to ask.
Just hold on. I'll give him a supplementary. Yes. Let's take 3 for
Thank you.
supplementaries, then you finish up.
Thank you, Mr. Speaker.
One question each.
Yes, for the CS are tried to answer my questions, but he has not clearly stated how much money in terms of contributions were in the accounts for NHIF and transferred to Social Health Insurance Fund.
Okay.
And then for the sake of my mother, the CS, can you please explain to us what motivated the ministry to introduce SHA and SHIF when NHIF was indeed working? Thank you.
But you are the ones who passed the law here. Basil, you are the ones who passed the law on what you are asking. Yes, Chepkonga, one question each. Yes, Kakuja, I'll give you.
Thank you very much, Mr. Speaker. I can confirm that we passed 4 legislations and the Committee on Delegated Legislation indeed approved 4 regulations, and we are in the process of approving the 5th one, Mr. Speaker. Mr. Speaker, you know the CS has spoken very well in a very flowery language about the benefits of SHA and how it is helping Kenyans. Mr. Speaker, you know, if we were to go out and say all these things, we may possibly be stoned, Mr. Speaker, because we have no evidence. And you as a lawyer, Mr. Speaker, you know, there is something called compelling evidence. Compelling evidence requires documentary proof or evidence, Mr. Speaker. Mr. Speaker, is it possible for SHIF or SHA or the ministry itself to give us flyers of the benefits of SHA? For example, Mr. Speaker, when they speak about the increment from 4,000 per night to 20,000 in an ICU bed, Mr. Speaker, where is this found? We've just had it. It is oral in nature. Mr. Speaker, is it possible to provide those benefits
Point
in
made.
flyers, Mr. Speaker?
Milemba, Kagusha, don't be agitated. I'll give you.
Thank you, Honorable Speaker. In fact, the Honorable Minister
One question each.
is quite clear on the way he's answering question and bordering flamboyance, the way my Honorable Member put it. But there are some specifics, and I'm happy, Honorable Speaker, the country is watching. That, and your technical team is here, Honorable Minister. You know, Vihiga referral, or Vihiga, the big hospital in Vihiga, is performing very poorly in terms of drugs. And you talked about refunds, or the money we remit to these hospitals, courtesy of what they have done. in terms of treatment of the patients. And they are owing, you are owing Vihiga 60 million. Possibly this is why we have this challenge. Also in the same county, we have Sabatia Hospital, we have a Muhaya Hospital, we have a Misi, your technical staff is here and they can check through, and we have a Musire, which are odd monies, and we don't have drugs. Could you explain what your ministry is doing to make sure that apart from this good talk we are speaking, we are also making sure that this hospital, among others in the country, get the refunds, or that language you used, so that they may buy the drugs. Thank you.
Gagusha.
Thank you, Honorable Speaker. I know Nyeri has been mentioned many times, especially on the good record on how it has registered in this program. I'm surprised to say that to see that the CS says that Nyeri has been resisting. It is not true. Nyeri has been on the front line of registering the people, and I think they stand to be part of the biggest beneficiaries to where they benefit. What we do in Nyeri is to follow this program to ensure that it is working properly. Honorable Speaker, as of last week on Thursday, and I want to follow on what the Honorable Chepkonga has raised on the issue of ICU bed, and what is the answer here on the issue of Honorable Kawanjiko, that the ICU bed has been raised from 4,000 to 28,000. Honorable Speaker, we got a circular on 15th of December where the ministry did state that the maximum you can get from an ICU bed is 4,400, I think. And I think the lowest should be 3,300. Honorable Speaker, we do not have any other circular that has cancelled or improved or changed that particular circular. And I want to demonstrate practically. On Thursday last week, Mr. Nanga Kigoshi, who hails from Mutonga Karaba sublocation in Mukurweini constituency, was admitted in Mukurweini Hospital, and he got into a coma and was supposed to be transferred to an ICU bed. And the only ICU bed that was available was in Madari Hospital and Tumutumu Hospital. Mr. Nanga Kigoshi could not have been transferred from Mukurweini Hospital to either of those two hospitals because they all required a deposit of 80,000 for the patient to be admitted in an ICU bed. Eventually, the patient died in the process of, getting him an ICU bed. And the family had been forced to get between 60 to 80,000 shillings for him to be admitted in an ICU bed. So I think the Honorable Minister will need to be clear on this issue of the benefit on ICU. And those are some of the areas where we are finding what is being given by the ministry and what is on the ground being very different.
Transoya Women Rep.
Thank you, Mr. Speaker. He's talking about Shakahola, referring to a hospital in Transoya. Mr. CS, my question is, I don't know what measures you're going to put across because the propaganda is ahead of us. And I think what people are lacking in Kenya is the right information on SHA, because truth be told, it is working. But I think the information that have been given is SHA is supposed to pay for all the bills that the patient incurs, which I think SHA doesn't do that. And it is important that they get to know exactly what SHA pays and to what extent it pays and what they're supposed to top up. Then secondly, Mr. CS, teachers and police officers are really complaining. And I think I get their complaint so clearly. And if there are people who can easily finish this SHA thing and propagate very fast are the teachers, because majority of the teachers are the ones who are chairmen in most of the meetings in our villages. So how I wish, because their complaint is they've been given very few choices on the hospitals they go to, which they feel it is not fair to them. The options that they've been given.
Point made. Finish your question.
Okay, my question is, I wanted, if possible, they be given a vast options for them to choose so they can be attended to a good number of hospitals in this country.
Thank you. Mukunji, one question.
Thank you, Honorable Speaker. Honorable Speaker, during the NHIF time,
I used to spare some resources of NGCDF to pay for the most vulnerable members of public their NHIF, Honorable Speaker. But this time, Honorable Speaker, it has been very difficult. And this aligned also with, I sit in the Committee of Constitutional Oversight and Implementation,